very much felt like an individualised, person-centred service.
It's been brilliant. All the staff have been really proactive. We've seen 3 different medical professionals in a short space of time, and they've just got the job done, ready for her to go to theatre.
I think all the staff have been really friendly to me, and I think the main thing is that everyone will look at you and smile.
Our paediatric surgery day at Kidderminster, the lists are dedicated to paediatrics, so we sort of take over the whole department for the day. We have all sorts of surgeries going on today. We have ENT, Max Fax, urology, and ophthalmology and community dentals. Recently we have worked with Birmingham Children's Hospital to bring their urology service over here. So what we have done is we've opened up Children's Clinic on a Friday afternoon who hosts a urology consultant who and our team will pre-op them, and then they will have their surgery on site at Kidderminster with one of the urology surgeons from BCH.
We spoke to parents, children and our staff about their experience with our paediatric services. Across the day, we spoke to families attending blood tests, scans, surgery appointments. At the start of the morning, I spoke to some of the parents and children in the waiting room to see how they were feeling.
A little bit anxious. But I know he's in safe hands. I think I'm just more anxious for him because he's scared, but we've kind of reassured him that he's in safe hands and everything's going to be fine. But he's excited at the same time because he gets to bring his toys. And it's a day out. We normally go to Children's in Birmingham. So, yeah, this is our first Kidderminster. When I come in, I said, this is nice. It's nice for them, I think, as well, because obviously when they're so little, it can be a lot of pressure. The unknown for them, isn't it? So I think if they have to stay for a couple of days, it's the unknown, and I think that's what could make them more anxious. Whereas if they're in and out, they can get back to their own safe place. And
yeah, fine. To be honest, for us, we've been waiting quite a while for this, so it's quite nice to be getting it finally done. If you get what I mean, it's just nervous in general because obviously it's with our little, and he's never been put to sleep to have an MRI, so that's always in the back of your head.
Is this the first time he's had an MRI?
This will be his first one, as far as I'm aware. Hopefully, it'll give us more answers, so then, we know how to approach things better.
Thank you for taking the time to speak to me this morning. I hope everything goes well with you this afternoon. While we're here, we're going to be speaking with Sarah Smith, county-wide lead for MRI, and she's going to talk a little bit more about the paediatric services we offer today at Kidderminster.
I'm Sarah Smith. I'm county-wide modality lead for MRI. So we're at Kidderminster Treatment Centre today. We offer a GA, a general anaesthetic for a paediatric patient for an MRI scan. MRI is very sensitive to movement. They take quite a long time, so the average scan I would say would be between 20 to 40 minutes. Paediatric children in general, they find it very difficult to keep still for that amount of time. They struggle with busy environments and overstimulation. It could be quite challenging for them in experiencing that. It's a very open, very patient-friendly building. So it's right from the word go. They're coming in. It's a nice open environment. I would say it's not intimidating, and that helps, I think, when they're their first impressions as they come through. It's a nice, light, bright building.
Oh, well, thank you, Sarah, for taking the time to speak to me today. While I continue to speaking to some of the patients in our children clinic, my colleague Becky is over talking to one of our little patients called Thomas in the pre-op assessment area.
How old are you, Thomas?
1, 2, 3, 4, 5, 6, 7.
7 years old. And have you come into Kidderminster Hospital today for a little procedure? Yeah? And how are you feeling?
Yeah, I was scared. What were you? So that's it.
Yeah, but you've spoken to all the nurses, and have they made you feel a bit happier? Yeah? Do you remember what we watched last night to help you feel better as well? What did we watch?
Mickey's Journey.
Yeah, you did Mickey's Journey. And so, not very long, you'll be back out, and you can talk to me again to tell me that everything went really well, and it was all fine. And how are you feeling, Mum?
I'm feeling okay. We're well looked after. Everyone's explained everything to us. So, we're just going to take one step at a time, and hopefully everything will be okay.
And how long did you have to come in for this morning before your appointment?
We've been quite straight in, haven't we? We only had to wait for about 15, 20 minutes. And then we've been straight through to be seen.
That was Becky catching up with Thomas and his mother before they head down into surgery. As members of the team continue to spend the morning catching up with some of our little patients, I caught up with some of our staff to see what they love about working in paediatrics.
I like supporting families in the hardest times of their life with their children when they're poorly, and I enjoy working with my team because we support each other and we're always there for each other.
Working with children and young people, as a play specialist, I love just that you come into work just making a difference to a child or young person's journey in hospital, even if it's giving them 2 seconds of your time or 10 minutes of your time, and just getting creative and lots of play sessions and the paint out, getting the Play-Doh out. One of my favourite activities to do with children and young people is doing a very good one is syringe painting. Ooh. Where you put paint into syringes and let the children loose to get messy. They can cover the walls in paint if they want to outside. It's a very good one for the summer as well.
I also caught up with Andy Robb, who is one of the consultant paediatric urologists from Birmingham Women's and Children's Hospital.
My name is Andy Robb, and I'm one of the consultant paediatric urologists from Birmingham Children's Hospital. We have started to do an outreach service over at Kidderminster where every other week we come out and we will run a clinic and we'll run a theatre list. It's a really nice place to work. Everybody's very chilled out. They're very focused on what's going on. This is the first time that we have set this up where we actually provide theatre lists. It's an incredibly good working model. It means that we get to have relationships with the clinicians and the teams locally, but they also have access to us so that we know that if there's problems in the future, we've got the contacts where we can speak to and sort the patients out so that they're not having to come into Birmingham.
Thanks, Andy, for taking the time to speak to me. It's really great to hear about the collaborative work going on. And this is only the beginning. Next, we're going to be catching up with Anna and her son Luca, who are just about to go into surgery, to talk about how their experience has been so far at Kidderminster Hospital today.
It's been really good. I think it started before today. I was sharing with the nurse when we arrived. We had a pre-operative assessment, so somebody telephoned me, and it was really reassuring. It was really thorough. It felt kind, and I felt a bit scooped up. And all of sort of like my questions were answered before I came today. So we felt really prepared.
Is this your first time at Kidderminster Hospital?
Yes, as a mum. We met somebody who showed us the way to come in, actually from the reception desk. They were really, really helpful, told us where to go. And then literally all the different people we've met so far have been really lovely. Everyone's helped us. I think we've had our questions answered. I'm feeling like we're in safe hands. And that's important, with some friendly and familiar faces. So that's reassuring.
How was the pre-op assessment you had?
Beverly, who did the pre-operative assessment, she answered everything and was really thorough. Really important for a positive patient experience. She also didn't presume anything. So she didn't make a presumption because my son's a certain age, therefore he'll want this or he won't want that. Offered everything, and it very much felt like an individualised, person-centred service.
Hi, Luca. How are you? How are you feeling today? You nervous?
I think initially before I came here, I felt quite nervous. I mean, as you do with surgery. But yeah, I think all the staff have been really friendly to me. And I think the main thing is that everyone will look at you and smile. The reception staff, they've been great. You know, they've been friendly. And then Catherine with a K, who I just had. Yeah, she's great. Very radiant. And everyone was really nice and friendly.
Soon you'll be heading into surgery, and then later this evening you'll be heading back home. What's the one treat you're looking forward to the most after today?
I have to say Wingstop.
I wish you all the best, fingers crossed, and good luck in surgery. And while we're here, we're going to catch up with Louise Bowyer, who works for Worcestershire Community Dental Services, but I will let her introduce herself.
My name's Louise Bowyer. I'm Senior Dental Officer in Paediatrics for Worcester Community Dental Services. We're here at Kidderminster Treatment Centre today for our general anaesthetic list where we extract people's teeth while their patients are asleep. We've got a full list of paediatric patients today who've come to us from across the county, from our different clinics, and they all come here to Kidderminster for their treatment. So our patients in particular are quite a difficult cohort or an unusual one for the fact that anaesthetic is the last resort for our patients. It means that they've been to see us in clinic and had tried to have their treatment done just in the dental chair, maybe with some inhalation sedation or other acclimatisation aids, and unfortunately that hasn't been successful for them. So then this is the final option for them, where they are put to sleep to have their treatment done. So bringing them to a paediatric friendly environment is really important.
Thanks, Louise. It's always great to catch up, and I will hopefully see you soon. We've seen surgeries, we've seen tooth removals, we've seen MRI scans, we've seen blood tests, and finally today, Ella, one of my colleagues, is going to be speaking with Georgie and her daughter Daisy, as she has just come out of surgery after having her tooth removal, and we're going to see what they're up to next.
Hi, I'm Georgie. This is Daisy, my daughter. She's had her tooth removal today. She's just come out. She's doing well. She's had her obs done. They're going really well. So, yeah, we're just waiting to leave now.
Did everything go okay today? Was it a smooth process? How was it?
Yeah, no, it was all a smooth process from start to end. Operating room, came through, went into the main room, operating room. And then there's a waiting room there for parents. Then we just wait, that dreaded wait, until you hear back from how your child is, and then yes, back to Daisy now. So it's been a smooth process, and everything's gone as well as it can.
What a positive experience to round up the episode on. I wish Daisy all the best in her recovery, and I hope everything goes well. Throughout the day at Kidderminster Hospital, families shared stories with us about anxiety, waiting, or even uncertainty. But they all spoke about kindness, reassurance, in that they felt supported. From surgery and scans to blood tests and play sessions, these conversations today just offer a little insight into our paediatric services at Kidderminster.